that does a lot of support work through our phone lines in the spaces of AOD and family and domestic violence. And a lot of those principles come into our work, and there's a lot of correlation between the way that we work. And we're really hopeful that in starting some of these conversations today and sharing a bit more around our learnings in working with community, it can help inform reflections, practice, or as Anna said, further conversations. So thank you so much. And I would just like to also acknowledge the traditional owners of the lands that we're joining from today. As I said, for me, that's the land of the Wurundjeri people of the Kulin Nation, and acknowledge that in doing a national campaign like Changing the Landscape, acknowledge all of the traditional lands of everyone who has contributed to the campaign so far all around the country, and acknowledge that as we are seeking to make change and tell stories and advocate on this land, we're doing so on land where that has been done for tens of thousands of years, and this always was and always will be Aboriginal land. As we mentioned, I've got the lovely Anna McPhee with me, who's the Acting Suicide Prevention Manager, and my name is Maya Elazam. We will share contact details at the end of the session as well. And just a really quick note before I hand over to Anna to talk about our suicide prevention programs is just a note on the acronym that we use to describe our communities. We use the acronym LGBTIQA+SB, and the S and B are to acknowledge sister girls and brother boys, which is many of our Aboriginal and Torres Strait Islander trans and gender diverse community members. This is something that came through really, really strongly through our co-design, which I'll talk a bit more about later in the session, but it was incredibly important to us that as we're advocating on a national scale and particularly advocating to government, we were using an acronym that acknowledged Rainbow Mob. And it's been really exciting to hear some of the conversations that we've been having with policymakers, hearing this acronym used more and more, which makes us really hopeful in many ways. But I'll hand over to Anna.
Thanks, Maya. And I think just a note on that too is you might be doing different trainings at different points with LGBTIQA+ kind of inclusion or this kind of work. And just to note that sometimes that acronym can look different, can include different letters to a different extent or lesser extent. And just to say that language often changes in our communities. And so therefore things like the acronym also change. And so sometimes it might feel a bit confusing, but just to know that if you're trying to keep track, that can be hard sometimes, but know that it can change across time as well. To give you a little bit of background about Switchboard, just wanted to give you a bit of an overview, and we'll put some links in the chat and allow you to do some of your own reading if that's something you'd like to do. But Switchboard is a Victoria's LGBTIQA+ peer support service. There's a range of different kinds of organisations in Victoria, but Switchboard itself is peer-driven and community-controlled. So that's what does set us apart. In lots of ways, we are unique in that we are everyone in the organisation, from governance to staff to service users, are all part of our communities. But we also do support workers and families and allies who support our communities too. We've been around since, going to say we're 33 years old, and we started in the peak of what was the AIDS crisis at the time as a phone line that was about people being able to reach out for support around HIV. And from there we've grown enormously. So from our volunteer base of peer workers, we now have over 60 staff. We run 2 7-day-a-week helplines. We have 6 programs altogether now, some of which I'll just mention briefly. We have like a Rainbow Families program to support families of LGBTIQA+ people, 2 peer support lines, an older persons program, and a program which supports queer and trans people of colour, as well as the suicide prevention team, which is the team that Maya and myself work on. So yes, we'll post you the link so you can read about our services more fully, but just to give you a bit more context around the work that Maya and I are doing at the moment, our team provide different kinds of responses to suicide prevention, which I'll go into a little bit more detail of, but most of the work that we're doing at the moment is centred around supporting community need. We have a lived experience network of now over 60 people that contribute to our suicide prevention work, and that program is national. So I wanted to kind of highlight that for you, because I know that we're down here in Victoria, but because lots of the work that we do now is online, we've been able to extend the scope of what we provide, which is really amazing. And this is a space that provides an opportunity for people who have lived experience of suicide. That might be that they experience their own thoughts of suicide, have experienced their own thoughts of suicide, or care for or are bereaved by suicide. And this is a really amazing network which allows for a community of people to come together and advocate for change. And the change in the landscape work that Maya will speak more to later is a real, a beautiful example of the ways that the network came together and advocated and collaborated in the co-design process for creating this campaign which calls for better care for LGBTIQA+ people. We do a suicide bereavement program here in our team, which is about supporting LGBTIQA+ people who are bereaved by suicide. This is the only suicide bereavement program in the country that is for our communities. Again, this has been able to be extended across the country, so we support people in all different states of Australia, which is has been really successful in being able to roll that out nationally. So please, if you know of anyone, you're working with anyone, or just keeping aware about our programs being able to be delivered across the country, that feels really important. And alongside these groups and working directly with community, we run a range of different trainings and advocacy and research, of course. Thanks, Maya. I think I've just got some visuals on the next of some of the programs that we're running. So there are 8-week bereavement groups. We also run creative spaces and drop-in groups, our national lived experience network, and just some of the postvention responses that we've created, as well as some of the research that we're doing. So that's our beautiful visuals. This is Charlie, which I'll link you to as well, but Charlie is our national suicide prevention hub for LGBTIQA+ people. And you can see here that's people who have thought about suicide, lived through suicide attempts, supported others in distress, or live with the pain and the loss through suicide. So this hub is a really, I'd say, it's a really unique offering that the network came up with. So we're able to provide here lived experience stories that the network contributed to. We've got different kinds of fact sheets around what it means to potentially be seeking help for yourself or somebody else, as well as just a range of other resources that we understand to be really useful. Something that felt really important about creating this hub was, as a community-run organisation, responding to people who are in distress or who have thoughts of suicide without being able to provide them with any kind of resources where their experiences were reflected, that they were reaching out to organisations where perhaps the resources that were being able to be shared didn't have anyone that had relationships like them. People didn't look like them. It did feel like there was a real disconnect with what our communities were able to read and have available to them versus what their actual experiences were. So this feels like a really important hub for our communities. We're really proud of it, and yeah, would love for you to just be aware of this as a resource. It's because it is nationally created, it does feel like there is a relevance across the country as well. So we've tried to make it as accessible and as broad as we can to be able to be able to share across different demographics within our communities too. Thanks, Maya. We wanted to include this just for a bit of context around suicide prevention here. So our program offers a range of different approaches to understanding and responding to suicide prevention. I'll locate Maya's work in awareness and campaign advocacy raising. So we're thinking about here the ways that awareness actually contributes to a model of suicide prevention care. We might be thinking about prevention, which is around stigma, perhaps education, thinking about how we represent suicide within media, and think about how rights that people might have in accessing care. So all of these things could be considered in prevention. Intervention might be about first responders, so what kind of skills that workers might have or communities might have in being able to intervene if someone is having thoughts of suicide or needs support. There's post-intervention support, so this is where there might be secondary consultation, any kind of follow-ups that might be needed in communities and connecting people into more ongoing support. And then we think about suicide post-prevention, which is around providing support for folks who have been impacted by suicide loss. So we kind of operate across this spectrum in different ways, but you could probably see some of what I've said of how that might fit in. So we're thinking about prevention as perhaps Charlie, our lived experience website. Intervention might be our helplines. Post-intervention might be our helplines and our suicide prevention, secondary consult support, and then post-vention is our bereavement and groups that we run there. So all of these kind of operate across a model of what it means to do suicide prevention. Thanks, Maya. So Maya and I were talking about what we might like to, I guess, offer and bring into this webinar today in ways that felt like maybe tangible or ways that might allow you to reflect on and think about the work that you're doing. And so we just had a little bit of a brainstorm about the kinds of questions that we might like to offer you to be able to guide what it means for you to provide or strengthen your supports for LGBTIQA+SB people, and the kinds of things that we have learned in running community organisations in suicide prevention care. And I understand that there might be different kinds of ways that an AOD lens might be applied here too, but really understanding that these kinds of questions allow us to think about what it means to provide a non-pathologising or a kind of community framing that we understand for our communities feels really important for them in being able to access care. So some of what we bring in here is about understanding that for our communities, accessing support feels most accessible, most safe, and we're more likely to reach out for support if we know that there's going to be a response that feels either peer-run, that we know there's going to be LGBTIQA+ people within a response, that our lives are considered or visible, and that there might not be questions around, or we have some kind of belief that there's literacy around what it means to be LGBTIQA+SB. So May, I'll get you to go to the next slide, but just wanted to offer you perhaps these questions as a guiding way of understanding what it might mean to bring in a lived experience, peer framing that might move away from what could be seen as like a pathologizing or way of really disconnecting our lives from our identities. So some of the questions might be, what makes LGBTIQA+SB lives feel livable? How can we help LGBTIQA+SB people feel alive? What gives our communities hope? How can we support the development of secure LGBTIQA+ and SB identities? And how can we celebrate our diverse identities and communities? I wonder as well, we could always send these through afterwards as an email as well, if this feels helpful, but if you wanted to jot them down. And next slide, Maya, was just kind of continuing on here, but ways that we might reflect on creating these spaces to feel accessible, but as well expansive for our communities, and to be able to create new narratives or new ways of thinking about our experiences and our stories. So how do we tell our stories in ways that feel connective, expansive, and name the systems of harm? And how do we disrupt harmful narratives around suicide in our communities? So I hope that some of these questions might give you some ideas perhaps even feel inspiring to some of the work that you might be doing around creating LGBTIQA+ inclusion in your work. And I hope it's maybe provided some kind of queered lens to suicide prevention as you might understand it and as you might know it. And I think, just to say that this kind of framing informs our practice and informs the way that we run our services, and has informed the campaign that Maya's really, Maya will expand on in a moment, but has just so beautifully constructed with our lived experience network, as well as various other communities along the way. So I'll hand over to Maya to speak more to that, if that's all good, Maya.
Awesome. Thank you so much,
Great.
Anna. Yeah, so, Switchboard has been really fortunate to learn a lot from our communities, to connect with our communities nationally, and understand, I guess, how people interact with the healthcare system. And our understanding of this is ever growing, as Anna said. And as we do seek to disrupt these narratives and deconstruct, I guess, like the systems of harm that do impact our communities, like stigma, discrimination, historical pathologization, as Anna mentioned, and we seek to ask those questions around, like, how do we actually set up LGBTIQA+SB people and communities to thrive? Answering those questions and learning and connecting with all those people is ultimately what led us to designing Changing the Landscape, which, as I mentioned, is a national campaign seeking to create a future where LGBTIQA+SB suicide prevention is a national priority. And when we say suicide prevention, we know that this doesn't just impact, the more, what we would understand is like the more acute end of suicide prevention care. We know this is, suicide prevention is a whole of system issue. It's a whole of community service response challenge. It's a social challenge, like all of these things. And we're really looking at what foundationally needs to change within our healthcare and community support systems to enable a service system that LGBTIQA+SB people can access safely and meaningfully. And in that way, Changing the Landscape is really our way to fight for all the people in our communities whose lives have ended too soon through suicide. And in doing this work, we really seek to remember and do justice to their lives, their struggles, and forever their place in our community. And I really just wanted to take a second here to acknowledge the little graphic at the top here. This is of our Remembering Rainbow. The Remembering Rainbow, and I don't know if you want to jump in and speak to it very briefly. Yeah.
Yeah, I can speak to Remembering Rainbow. So I can, I'll also post a photo here in the chat as well, but we created a memorial for LGBTIQA+ people that we have lost to suicide within our communities. So what felt really important was that we had an advocacy piece that was sort of like this collective piece of activism that we created with people who were bereaved, and each ribbon has the name embroidered of someone that someone has lost to suicide, and being able to create these spaces of visibility, remember people's lives, and to see that in context of a community response felt like it was a really important thing to do. And we understand that for individuals participating in that memorial and to create a ribbon for someone that they've lost, being able to locate their life in a queer way, that we understand that lots of people in our communities might be locked out of grieving kind of processes, that families of origin might not acknowledge someone who's trans and gender diverse by the name that they've changed their name to. Being able to reflect someone's gender identity through something like a ribbon has felt really important to people. So knowing that there's a place where someone's story doesn't feel lost, and that people know that they're contributing to something that is about memory and is about honouring, has felt like a really important thing to be able to offer in the program. And I'll pop it in the chat. Thanks, Maya.
Thanks, Anna. And I will say as well, like, something that we do invite community members from around the country to do is actually to send us a ribbon to tie onto the rainbow if they're not able to come and see the rainbow in person as well. So that's another thing that, we're able to offer around the country, which feels really, really special and wonderful. So in considering these ways of remembering, these ways of doing justice to our communities and seeking to create a better future for our entire community, our vision, I guess, of what we're hoping to achieve is we want to achieve a healthcare system where LGBTIQA+SB people feel affirmed and included. And we also want to ensure that LGBTIQA+SB people have clear, affirming pathways to accessing services and immediate support. And once again, that is not just, suicide prevention services. It is AOD services, family violence services, all of the things that we understand that actually do a lot of inherently suicide prevention work by virtue of the work that you do deliver. And the goals that we're seeking to achieve through the campaign to enable this vision are threefold. So we want LGBTIQA+SB people with lived experience to be included, supported, and considered in the design of services across data, service models, staffing models, governance, and leadership, sort of really understanding that in maybe some of the bureaucratic systems that we understand really impact our healthcare systems and our community service responses, actually embedding leadership from our communities is a huge part of what is able to start to create that foundational change. The second goal is that organisations and governments make a visible commitment to providing affirming care to our communities through public support, resources and funding, particularly with the release, there was a recent release of a federal 10-year LGBTIQA+ health and wellbeing action plan. It's the first one in the country's history. And so part of the things that we I guess, are investigating and seeking to engage with is, okay, if we've got these action plans and we've got these ideas and the government has acknowledged that these are things that we need to change and we need to improve, how do we actually create systems of accountability in that? And then our third goal is that organisations and practitioners that deliver suicide prevention care feel equipped and confident in providing affirming care to our communities. A lot of the time we hear that it's really difficult, that it's hard to, and as mentioned before, it can be hard to get the language right. There's not enough time, all of these things. And what we're really trying to work with people to do is find creative ways of saying, okay, but what if we flip this? What time and space do you have? How can we optimize the constraints that you are working within to create systems of hope and possibility? How do we flip the questions that we ask? How do we do all these things to work, to start to change these systems in a way that can be practical and have a real impact on people in a one-on-one context? Something that we always like to share that was an insight from one of our co-design participants is sometimes even when systems are really difficult and aren't set up to support our communities, acknowledging that is such a great first step. And they've given permission to share an example of, being in a healthcare setting as a trans and gender diverse person and having to have their sex assigned at birth recorded on their chart for a medical reason, and a nurse just actually saying to them, I know that this isn't representative of who you are. I know that this is difficult. I'm sorry that this is the way it is. And they said that acknowledgement just really, all of a sudden, instead of them trying to, being in opposition to the healthcare system in trying to access the care that they really needed, all of a sudden they were in this together and they were just sitting in it together. And even though it didn't fix the issue, it didn't fix the feelings of invalidation, it acknowledged that they existed. And all of a sudden the nurse and this person were able to work together as opposed to, working in opposition, which was really wonderful. Our statement is a formalization of that, I guess, like the goals and the vision and the things that we know foundationally really need to change to enable our vision to occur. The Change of the Landscape statement is a statement on the necessity of our community's leadership and lived experience across all parts of Australian healthcare to achieve the highest attainable standards of suicide prevention for all LGBTIQA+SB people. And this statement is from community for community. It has been informed and driven by LGBTIQA+SB people with lived experiences of suicide, many of whom have come through our lived experience network, as Anna mentioned. And this document really sets to, I guess, create the context that we're operating in. We know there are a lot of harmful narratives that exist around our communities and suicide. One that we often hear is when someone from our communities dies by suicide is that their LGBTIQA+SB identity is what caused their death and caused the central nature of their distress. And we know that this is incredibly harmful because it removes the onus on discrimination, stigma, isolation, and things that are the actual drivers of suicide. But it also completely removes the protective nature of living as your affirmed self and having connection to community. We know those things are so important. And when we talk about someone's identity as something that is really inextricable, or as the basis for their death, we really remove the ability to have that conversation, and say, actually, what does, as you know, going back to that question of what makes LGBTIQA plus SB lives livable and what makes our communities feel alive. And so this document sort of outlines all of that. It really calls out that we experience higher rates of suicide, not because of who we are, but because of how we've been treated. It highlights the value and the positivity of lived experience-led initiatives, even though they are routinely underfunded. And it also outlines a series of recommendations. Those recommendations fall under the 3 pillars of recognition, community leadership, and funding. So recognition of our community's experiences and the value of LGBTIQA plus SB wisdom in responding to suicide. Community leadership, as I've spoken to a little bit, so embedding LGBTIQA plus SB people with lived experiences of suicide within our healthcare system to drive change, and also funding. We know, as is not news to anyone who's on this call, the reliance on innovation grants and funding cycles and all of these things hinders the capacity for growth across the sector and hinders our ability to form linkages and collaborate with each other. And, you know, we really know that that is something that really needs to change if we want to see sustainable change over time. So just a very brief note on, I guess, the journey that we took to get to the statement. This has been something that we've been working on really since 2019, when we were all sitting around, well, I was not at Switchboard yet, but some members of our suicide prevention team were sitting around thinking about, like, really how can we advocate for change in our communities? And we saw the success of some other statements that have been around in the healthcare sector that have had a really wonderful and market impact, namely the Gaia Dewey Declaration of Aboriginal and Torres Strait Islander Lived Experience Leadership, which is an excellent document, which we can also link in the link pack that we send around, and also the Darlington Statement of Intersex Human Rights. Both of these documents have had a significant impact on conversations within our healthcare and human rights sectors, have driven legislative change, policy change, or have provided an avenue to advocate for the changes that we need. And our team thought, how good would it be if there was something like this for our communities in the space of suicide prevention? And then it took until 2022 for us to receive some funding to actually do that. We are funded through the federal government in partnership with LGBTIQ plus Health Australia, who support us in building those national linkages. In 2023, we ran a series of co-design workshops that happened both at key sector conferences in March and May of 2023, and then also a more targeted co-design series at the end of 2023, where we brought together LGBTIQA plus SB people with lived experiences of suicide from across different intersections of the community. For instance, LGBTIQA plus SB, people of colour, LGBTIQA plus SB, people with experiences of disability, people of faith, young people, older people, really recognising that intersectionality can have an incredible impact on your ability to access care, and really wanting to create space to acknowledge that and to understand in a more, I guess, like nuanced and teased out way the different experiences for different people across our communities, which was wonderful. We then designed the statement based on that. So the statement has come from community members, and we then said, great, we've got the statement here. How can we then bring this to the sector in a way that feels meaningful and connective, and we can actually get organisations and workers like yourselves involved? So we ran an organisational consultation in March of last year, where we worked with a series of suicide prevention organisations and LGBTIQA plus SB organisations to bring these insights to the sector, to understand what their priorities were. How could they see this being used to advocate for what they need as well? And this was really exciting for us. We know collaboration can be quite challenging in healthcare and community response sectors, largely because, you know, we're all vying for resources and funding and are also incredibly hamstrung in the resources that we do have. And bringing organisations together felt so like such a win and so important in trying to do this work and really acknowledge that it's not about Switchboard. It's not about, what we're trying to do. Really, it's about all of us coming together and fighting for a better future for our communities. And that felt incredibly exciting. And, we really thought about the impact of that, community has been so involved in this, and we've been able to have organizations involved in this from the get-go as well. And then in July of last year, we launched it. We were very pleased to have a launch that had attendees from every state and territory. We had some remote launch parties happening around the country. In the Northern Territory AIDS and Hepatitis Council hosted a remote party to celebrate the launch. And it was beautiful to have those moments of collaboration and connection from across the country in support of our communities. It was really special. And since then, we have largely been working with community leaders and organizations to really, as Anna said, build that awareness, build that engagement, to have these conversations, talk about what needs to change, what are the opportunities in different workplaces and sectors to really bolster capacity to work with community. And our statement has garnered around 570 signatories to date from organizations including Are You OK, Mind Australia, the National Mental Health Consumer Alliance, Jesuit Social Services. It's been really wonderful to watch this connect across different sectors and also connect with organizations that are religiously affiliated or are based in different states and territories. And we are very excited to continue on this train over the next few months. Some of the things that we do, as well as being able to come and do things like this, which we love, is we run events with and for LGBTIQA+SB communities and our allies. We provide resources to organisations to improve how they work with our communities. We advocate for change through our statement. We seek to share and elevate lived experience stories and expertise from within our communities, understanding that storytelling is one of the most powerful and connective tools that we have to disrupt these systems. And we also seek to advocate for changes to how our media talks about LGBTIQA+SB suicide, understanding that the way that our professionalized sectors talk about suicide impacts how the media talks about it, which impacts how we talk about it socially. Like, all of these things are really connected. And that feels really important to us as well. Especially when we see that these harmful narratives, as I mentioned before, can really be the things that people hold about our communities and suicide, and those things can be quite difficult to deconstruct. These are some examples of things that we've done previously. So we ran a webinar last year with queer advocate Will Strake around advocacy and health resistance for days of significance. For instance, this was for Lesbian Visibility Day. We shared stories about, iconic lesbians from our history. And then we also run storytelling campaigns to try and elevate community stories, which is really fun and exciting. But really, the thing that is wonderful about this program is that we are open. We don't have a roadmap for what happens next or where we go or what our guardrails are, which means that if you see an opportunity for collaboration, reach out to us. If there's a resource you think your community could benefit from, a story that you think needs to be shared, if there are local advocacy initiatives happening on the ground that you think, even if it's just us being able to send a bunch of Changing the Landscape logo pins in a show of solidarity to support a local advocacy initiative, those are all the things that we love doing. And we really understand that building those connections over time and being in solidarity with advocacy initiatives across the country is part of what creates this nationally driven and connected system where we can all support each other to build our capacity for change. And we really encourage you to get in contact to discuss more with ideas, anything at all. Particularly, we know that particularly in the Northern Territory, there are some things going on with flags in hospitals and having pride flags visible in hospitals and things like that. If you see any opportunities for solidarity or discussion, we always encourage you to reach out. Beautiful. Other ways that you can get involved if you're interested in keeping up to date with the campaign is you can sign our statement as an organisation or an individual through our website. You can share the campaign on your organisation's social media or through newsletters, and you can also sign up to our newsletter and follow us on socials to keep up to date with what we're doing, which is all fun, and we promise that we won't spam you too much. And so that's the end of our presentation. We will, of course, send these links around in an email as well, but there are links here just to the Changing the Landscape website and also to Charlie, which is our suicide prevention hub that Anna was speaking to previously. I guess the thing that